Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athlete trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this week's episode, we have an interview episode that is perfect for the lead up to Thanksgiving.
It really is, but there's honestly so much tied to the gut.
Yes, absolutely there is.
I mean, when you think about sleep, nutrition, exercise, well, speaking of exercise, I feel like we as a profession don't really use gastroenterologists as much as we probably should.
I think like gut health and like from a sports medicine aspect and just athletic performance often gets forgotten. It's a system that I don't think a lot of people take into account.
Right. We're going to be talking about that today. We're going to be talking about common GI symptoms, red flags, how to approach an evaluation and referral to a gastroenterologist as an athletic trainer, really how this relates to nutrition, exercise, sleep, hydration, kind of like what we were talking about before, and then also touching upon improving gut health. And in order to do that, we brought on Dr. Robert Fearn. Randy, can you introduce him?
Yes. Dr. Fearn is a fellowship-trained UCI health gastroenterologist. He received his medical degree from the University of Leeds, Faculty of Medicine and Health in Leeds, England. He completed an internship in internal medicine in North Central London, followed by a fellowship in gastroenterology in Northeast London. Also, fun fact, he also received a master's degree in sports and exercise medicine from the University of Bath in England. First of all, doing a master's degree and then medical school, man. That's a lot of school.
Right. But it really kind of highlights that union that he has between sports and GI, which is really awesome. And Randy and I were just talking about this too. And like, we've had athletes with acute GI symptoms, but I think it wasn't really until this year that it kind of hit home that like, why is this something that we don't refer to as often? Like, this is something that anyone can deal with.
Yeah, absolutely. And I think it's like we've talked about before, is like how many people probably have like a gastroenterologist as part of their sports medicine team. I would say probably very few.
Not a lot.
And if anything, it's not like, it's probably like we have someone, I think.
Well, now we do.
Yeah, true.
And now you do too. You want to hear from Dr. Fearn?
Yep, let's do it. So at AT Corner, we really like to pair the evidence that's out there with also just the clinical experience. So if you could kick us off with maybe a story or an experience or even maybe a case study about the importance of GI health within athletes.
Yeah, sure. So this actually goes back to my time in the UK before I moved out here. But I was working as a gastroenterologist and working in sports, and I took a referral from an athlete who was a professional rugby player. And his issue was severe abdominal pain and cramping that would come on really any time he started practice or training, but really only on match days. And we went through everything. We couldn't really find any red flags. It was a little bit of a mystery. So I arranged some follow-up with him after a period of time. And I was just flicking through the channels a few days later. And I came across a show on one of the lesser-known sports channels. And it was a hot wing challenge. And my athlete was the host of this hot wing challenge. And it turns out, and these guys were really going for it. They were kind of upping the Scoville levels on each other all through. And it turns out that this guy regularly hosted a hot wing challenge, and really kind of went to town on the spice and the chilliness that he got. And when I went back and kind of gotten back to clinic a few days later and started probing this, he said, yeah, and actually, you know what, when I think about it, we only do the hot wing challenge when we're playing a home game. And my symptoms only happen when we're playing a home game. And it turns out that, yeah, when they're traveling, they don't have time to do the show. And so he didn't do it. And the symptoms timed perfectly. And the answer to his problems was purely chilly and Scoville level.
Oh my gosh, that's hilarious.
Was that a relief that you figured that out, or was that, how did you feel when you finally figured that?
I mean, I felt like I felt like maybe I should have probed a bit more of his his pre-match nutrition practices, perhaps. Yeah, it was a relief to kind of figure it out, to solve the mystery, and sort of a lesson that sometimes simple answers are the right answers, and actually it's not always some crazy strange diagnosis. It can be your basic practices, your basic preparation can make a big difference.
Right.
So now, a history question. Do you host a hot wing challenge?
Well, I don't. But I do like
someone who does.
But yeah, I know someone that does.
That is so funny. So you mentioned abdominal cramping as something that you look out for. What are some other common GI symptoms that you see?
Yeah, so athletes can present with any GI symptom, and they're highly variable and dependent to a certain extent on the sport and the demands of those sport. But the most commonly reported symptoms in athletes are abdominal cramping, diarrhea, and bloating discomfort.
Okay. Are there any symptoms that you wouldn't necessarily think of GI, but might be GI related, like maybe like canker sores in the mouth or anything like that?
Sure. So there's a number of conditions that affect the GI tract that are also kind of systemic inflammatory conditions as well. And this doesn't just go for athletes. This is part of how we work up a patient in or outside of the sports world. But yeah, we often ask about concomitant joint swelling or soreness, skin problems, mouth ulceration, hot, red, painful eyes. And the more of these you have together, the more likely there is of some kind of inflammatory underlying cause of the symptoms. But not everyone that presents with GI symptoms will have those things. Often the absence of those things is quite reassuring that it's just a single system issue.
How often are you seeing athletes in your practice?
So athletes form quite a big chunk of my practice now. I would say at the moment it's around 20 or 30%, and we're building up on that over time. I came to the States a few years ago and previously had a practice in the UK, and it was a much bigger proportion there. What we're finding is that there's quite a lot of need out there. Statistically, over 80% of athletes, professional or elite level athletes, will report one or more GI symptoms at some point, and we know about a quarter of those can be performance limiting. So there's a big need out there, and we've been setting up a clinic and a service really to help address that unmet need.
We were just talking about this beforehand, but I've had athletes with some GI like pre-diagnosis or conditions that they come in already with, and only until just actually right now I've never really made a referral from like something that I've noticed in an athlete straight to a GI. Yeah. Are you working with these athletes from like a younger age, or are you kind of seeing them and getting them diagnosed, or how often? Maybe the real question I'm asking is, do you usually see that condition young, or usually are you diagnosing them as they're like in their 20s, 30s, or older?
So the nature of GI issues is they can affect anyone at any age. I have a lot of athletes in my practice who are at school level, so usually high school going into college level. And that's a really critical time, because if you think about it, you've got this kind of, if you're a promising high school level athlete, you've got this short window of time, this 2-3 years to prove yourself. And during that time, so much is happening, going through puberty, growing, you've got the demands of schooling, you've got this uncertainty of, where you're going to go for college and what your whole life is going to pan out to be. And so it's kind of, traditionally, it's sort of hit and miss. I think a lot of high school age athletes kind of start to develop GI issues, get lost in the system, wait months or longer for their appointments, long time to get their workup done, to get procedures done. And sometimes kind of fall out the other end, having missed the opportunity. So I've got quite a big group of young athletes in my practice with conditions like Crohn's or ulcerative colitis that we really try and get things done quickly, get the workup done quickly, get the management right, introduce the nutritional elements early on, get the inflammation under control. And we've had some great successes. I just had an athlete who joined my clinic as a patient about 18 months ago with really nasty Crohn's disease affecting her small intestine, losing weight, in a lot of pain, unable to compete. And she just made it to her college scholarship as a sprinter.
Wow.
And,
That's so
she looks
exciting.
great now. She's met her height potential. She's put lean muscle mass back on. She looks powerful. She's happy. She's symptom free, and so it's really rewarding to help manage that group because the stakes are so high, aren't they?
No, absolutely. And you kind of touched on it, but how much could nutrition play a role in kind of aiding in some of these GI issues?
So nutrition is really important. I'd say about a third of what comes into our clinic is pure nutrition related. And that goes in two categories. One category are people that have GI symptoms, and actually it turns out nutrition is the reason. So athletes love supplements, they and athletic eating practices can be variable. We all know how important it is, and the role of sports nutrition, is better understood now than ever. But a lot of athletes, especially in team sports, are taking their advice from senior players or people that they follow or people that they've heard of doing certain things. And then when you dig into it, and a lot of these guys are presenting with, like I said, abdominal pain or cramping or bloating or diarrhea, and you look at their nutrient history, their supplement history, their timing of food, the content of food, that's often the trigger. There's a lot of highly fermentable carbohydrates, complex sugars and starches, even in the supplements, the stuff that the supplements are mixed in together with to make the tablets and capsules. And they can be the cause of some of those symptoms. So we have a lot of athletes that turns out that's the cause. And so just taking those things out can really address their issues and their concerns. And then there's another group, which is particularly in weight making sports, when there's a specific either body composition or weight target, addressing the fueling, addressing the components of the nutrition, and really addressing the performance nutrition needs. So, if you like, nutrition for performance directly, and nutrition as a cause of symptoms.
Are there any supplements that you've noticed that might not be as gut friendly, or is it mostly just the ingredients that are just making the tablet that make it that way?
I mean, it's highly variable. I'm always skeptical of the very, very highly compounded kind of multi-component supplements. So, the ones that scream at you from the bottle that they're going to, give you energy for hours and improve your muscle mass and replace all your micronutrient needs and make you feel better and make you feel well, because there can be too much, crammed into these things, and often it makes it actually very hard to unpick exactly what's giving benefit and what might be causing harm. So in fact, many years ago, I had a young power athlete, weightlifter, who developed jaundice and life-threatening liver failure after taking one of these highly compounded liver
oh my goodness.
sort of sports supplements. And so, anyone can develop a reaction to any component of a supplement. It's important to know what you're taking. It's important to know where it came from, be able to kind of verify its background, who manufactured it. And, athletes are responsible for what goes into their body from an anti-doping point of view as well. So it's super important that it comes from a verified source.
Absolutely, yeah.
Something you touched upon earlier was the performance aspect of it. How does exercise also affect the digestive system, or vice versa?
Yeah, so exercise has a profound effect on the gut physiology. When we start to exercise, our body starts seeing the gut almost as a blood storage organ. So at any one time, about a third of our blood supply is sitting in the liver and sitting in the blood vessels around our gut. The more you exercise and the more intensely you exercise, particularly in hot and humid conditions, the more those blood vessels start to close down. So you get this kind of stress hormone reaction from the brain, the adrenaline, the noradrenaline starts flying, the blood vessels constrict, and it's really your body redirecting that blood flow from the mesenteric vessels to the skin and the muscles to help cooling, to help fueling, to help kind of get the glycogen where it needs to be. But as a result, it leaves the gut kind of almost ischemic. It doesn't have the blood supply almost that it needs to function. The problems come when you start to add nutrients or food into that gut that's now starved of blood and oxygen. Because, if you're in an endurance sport, that's kind of a necessity. Right? We need to continue to deliver those carbohydrates to replace all that glycogen and glucose that you're using. So it needs to get in somehow. And you're putting that into a gut that is kind of wanting to be asleep, wanting to be dormant. And that leaves things kind of sitting heavily in the stomach, sitting heavily in the small bowel. And one of the things that we see is, first of all, one of the causes of symptoms in endurance athletes who kind of follow fairly heavy fueling practices like taking on lots of gels and things like that, is that these things don't leave the stomach. So they sit in the stomach, they sit heavily, they start refluxing up in the esophagus, they can cause heartburn, they can cause vomiting. And you see that. You see people doubled over at the side of the road vomiting after taking in a drink or a gel. And the other thing that can happen is the gut lining is very, very thin, even at the best of times. It's designed to be thin. It's designed to absorb things. But when you take the blood supply away, it gets very leaky as well. So stuff that's in the bowel starts to find its way into the bloodstream. These include toxins and bacteria. So we actually can, and plenty of studies have shown this now, if you look at the inflammatory markers and the signs of kind of bacterial exposure during or after a marathon or an ultra marathon or ultra endurance races, you find high levels of these kind of toxic metabolites, these lipopolysaccharides or interleukins and things like that, that show that the immune system's been triggered. And this is a result of kind of the blood going away from the gut getting leakier, and the stuff that's in the bowel finding its way through to your bloodstream.
Interesting.
Does that have any effect on fatigue, or is that completely separate symptom?
It does, or it is thought to, I should say. And there's a lot of interest in fatigue's a really interesting area, obviously, in sports. And there's people have done huge amounts of work and research in this area. Some of fatigue is central, but a big part of fatigue is a peripheral thing. It's the body's response, or the brain's response to the body's kind of overutilization of its resources. When you look at people that have very sudden collapses, particularly heat exhaustion and heat stroke, you find very, very high levels of these toxic metabolites.
Oh, interesting.
Yeah.
And if you look at the people that go all the way through to heat stroke, the life-threatening condition of heat stroke, where your body temperature starts rising uncontrollably, then the gut is almost always involved in that. This kind of leaking of gut bacteria into the bloodstream, and it almost looks like sepsis. It's at least a theory of mine, and something that we're planning to do some research on in the coming years, that there is a continuum from kind of mild fatigue all the way through to heat stroke, and that the gut is really important in that. And there are probably things that athletes can do to protect the blood supply to the gut during exercise. And the theory, and certainly the hope, is that we can find things that by doing that can protect athletes from those more severe cases of the very severe abdominal pain, ischemic bowel, or heat stroke.
That also plays into the role of, I don't know if other, I know Crohn's specifically, but I don't know specific other gastrointestinal conditions and heat, how that plays a role.
Yeah, so
like heat tolerance.
Yeah, absolutely. So if there's existing inflammation in the bowel, then there's already a disruption in the lining, a disruption in that protective layer. And most people don't realize this, but the separation between the dirty layer of the inside of your bowel and the clean, sterile environment of your bloodstream is just one cell thick. So it's just one tiny little cell is separating you from the environment, from the dirtiest environment that we know, the inside of your gut. And in a way, it's remarkable that the body, has this extremely elegant system to kind of monitor the bugs that come through and things like that. But when there's existing inflammation, then a lot of that protection is already gone or already compromised. So it just makes it that much easier for stuff to get from the gut into the bloodstream. I don't know of any evidence that says that athletes with Crohn's are more likely to develop heat stroke, but I'm not sure anyone's done that research. But certainly, if you already have inflammation in the bowel, your chance of developing symptoms or problems while exercising is that much higher.
So you brought up you highlighted some things about like maybe looking into what maybe tools like an athlete can do to help kind of protect themselves from that fatigue or to hopefully stay off fatigue. Could you highlight some of those?
Yeah, sure. So a research group that I've been involved in for several years has looked at things that may affect that. So one of the things we looked at was probiotics. And the role of probiotics is interesting because you've already shown that athletes, particularly very high-level performance athletes and successful athletes, have a different microbiome to the general population, and the balance of bacteria, particularly the bacteria we consider that we classify as friendly bacteria, is higher. So it looks like a healthier microbiome. So that led to a theory that actually the microbiome may be playing a role in success in athletes. And so there's been a lot of interest in, if you supplement athletes with probiotics, what benefits can you find? So we know that supplementing athletes with probiotics reduces the occurrence of chest infections and coughs and colds. And recently we've shown that it actually reduces GI symptoms in athletes, in endurance athletes. So in the last third of a marathon, at least in our study, the athletes that took probiotics for 4 weeks before the competition were less likely to have GI symptoms than those that didn't. And we think that's because it's helping kind of build this healthy protective layer in the bowel and stop some of those toxins getting through. But we don't know that for sure. We're still trying to work out exactly why that happens.
I don't know if maybe I missed it. Do you know if they figured out if it's more of a cause or effect, or if the athletes who had better, like the gut microbiome came first, or if it was like the better athletes, quote unquote, had a better gut microbiome, or if the gut microbiome made them better athletes? Does that make sense?
Yeah. So it's a really good question, and it's something we don't actually know the answer to yet. So there's a lot of animal studies that have tried to answer that question. So there's a few very well constructed studies where you take animals like mice and you breed them in a sterile environment, so there's no bacteria in their gut at all. And then you introduce certain bacteria to their gut and see what happens. We know that if you introduce the bacteria that we consider to be the less favorable bacteria, it produces inflammation of the bowel. So you can actually create inflammation by giving certain bacteria into an otherwise kind of bacteria-free gut. And likewise, you can then make those better by then giving them more of the good bacteria or giving them a probiotic. So in animal studies, we have some evidence. In human studies, we're still working on it. We're still trying to kind of unpick that a little bit more.
So we're already kind of, I feel like, scratching the surface of it, but what would you kind of define as like something that's like good gut health?
Yeah, so gut health is so complicated. I think the best definition of good gut health is the absence of disease. That's where I start as a gastroenterologist. When somebody comes to me in clinic, I'm not necessarily thinking about how good is your gut bacteria. Do you have the right amount of bifidobacteria to lipopoly, whatever. I'm more interested, do you have Crohn's disease? Do you have ulcerative colitis? Do you have larger advanced precancerous polyps? Do you have colon cancer? In the upper GI tract, do you have gastric ulcer or H.
Mm-hmm.
pylori or Crohn's or celiac disease. So because these are the structural conditions that are immediately threatening to health and wellness. So where I start as a gastroenterologist is, do you have any, do you have any of the red flags that make me concerned that you have one of those bad things? And they're very easy these days to exclude.
Mm-hmm.
As far as wellness, there are. I think the makeup of your biome is sort of maybe a canary in the coal mine. I think we'll learn a lot more about that in the next 10 and
Mm-hmm.
20 years. But it's more about healthy practices. So how much of your diet is made up of ultra processed foods or,
Mm-hmm.
or
Mm-hmm.
foods that are potentially damaging to the gut? Like how much fiber do you get?
Mm-hmm.
Do you have healthy day-to-day practices? So some elite athletes have really unhealthy day-to-day practices, really unhealthy diets, eating ultra-processed
Mm-hmm.
food, only eating things that come out of a packet, and that
Mm-hmm.
they might be phenomenal athletes in the short term, but that's not conducive to good health in the long term. So
Mm-hmm.
when I think about gut health, I kind of think about it. Number one is the exclusion of disease. Number two, the kind of the dietary practices, the amount of fiber, and the amount of and limiting ultra processed food in the diet. And if I look inside a bowel, and it's not inflamed and there's no ulcers and there's no polyps, I would call that a healthy bowel.
Good. Oh, that's awesome. I like that.
Are there other things that affect the digestive system? Like, I know you talk about a lot about nutrition, but like hydration specifically, or
Mm.
stress or sleep.
Yeah, so hydration is really important. That whole process I talked about of blood being shunted away from
Mm-hmm.
the gut to the circulation, that happens much more in a dehydrated state. So I
Interesting.
worry, for example, a lot about weight making athletes that wear 5, 6,
Mm.
7 layers, put themselves in a sauna and run on a treadmill
Yep.
to make weight, because they are exposing themselves to significant heat stress,
Mm-hmm.
Mm-hmm.
and that can, as we've talked about, can have major adverse effects. Um, in terms of, we also know that the gut motility, the kind of emptying of the stomach and the normal movement of the bowel, is quite dependent on hydration. So if you're dehydrated, things just stop moving as they should do.
Mm-hmm.
And in a dehydrated state, you can't necessarily absorb in as efficient a way as well. So there's lots of reasons why hydration is important, for sure. The flip side of that is, if you hydrate in the wrong way or in a way that isn't kind of optimized for your body, then you can end up dumping large volumes of what is actually quite concentrated kind of sugar solutions into the stomach and bowel. They can
Mm-hmm.
create symptoms. We talked about that a little bit earlier.
Mm-hmm.
And they can actually dehydrate you further sometimes because they can draw fluid into the bowel and dump it out if your bowel
Mm.
motility is too fast. So there's a sweet spot for hydration. Not everyone needs to be drinking 5 Gatorades an hour. There's a sweet spot in kind of tailoring hydration to your own estimated at least fluid losses and electrolyte losses.
For the patient that may come in that might be experiencing like some GI symptoms, what are some important history questions that an AT should ask that patient?
Yeah, so there are some things that I think everyone should be aware of
Mm-hmm.
in kind of GI symptomology. So the flags that we're always looking for in clinic, if they're written in a kind of a referral note, I would always take more seriously is if there is profuse diarrhea, particularly if there's bloody diarrhea. So rectal bleeding in itself is a concern, but lots of people have a little bit of fresh red blood and wiping from hemorrhoids, and a lot of athletes will have a lot of that because of training practices.
Mm-hmm.
But if somebody was complaining of bloody diarrhea persistent for for several days or more, that would make me immediately concerned. If that's associated with abdominal pains, particularly cramping abdominal pains and weight loss, then that makes me even more concerned. So the red flags in GI typically are rectal bleeding, particularly when associated with diarrhea, weight loss, but any symptom that is progressive and has and intrusive and is affecting either quality of life or their ability to train and perform is is something that should be taken very seriously.
Are there any symptoms that, because you kind of brought up those red flags, are there anything that's like emergent, like something might happen, whether it's like a contact or they just come in with severe pain? Is there anything that's like, this is an ER trip, like you need to be seen immediately?
Severe pain and fevers, are
Got it.
things that I would immediately want to see. Vomiting of blood, and and large volume blood losses from the bottom end. So anything that's a couple more needs to be seen immediately.
Got it.
At what point would I differentiate? So, for example, your athlete with the one chip challenge or the hot chip, is there kind of a threshold that you would say, like, I think this is ready for a referral, or this is something that needs to see a gastro?
I think anything that is, even if it's self-reported, that it's limiting performance or limiting the ability to participate in training is, from an AT point of view, a really good threshold, because it may be that it is something really simple and it's a dietary practice, or it's just severe IBS. But I don't want to label it as that until they've had a clinical review. So anything that is intrusive enough that it's affecting somebody's ability to lead their day-to-day life, and for an athlete that means training or competing, that is a GI symptom, should be referred.
On that performance aspect, are there any GI pathologies that should restrict an athlete from participation?
There's actually very few. I think we've touched on things like there should be a caution if there's active inflammation in the bowel, or if there's severe symptoms that are leading to dehydration. So, for example, profuse watery diarrhea or vomiting. That means you can't get the fluid and hydration in. Old school practices were just push through. Come on, guys, you can do it. And we know even in the high school sports that was particularly dangerous. Early season football training was notorious for severe illness and even deaths in some situations. And thankfully, those practices have changed. But I would say they're the main ones. Is there if you are if it's affecting you systemically, if it's causing a fever, or it's causing dehydration, or it's causing just generalized malaise, then training through that usually is not a good idea.
I feel like there's, even when people come by and they have like the stomach flu, that's like not something that we want them training with either.
Yeah, exactly. We used to say when I worked in sports, anything above the neck is fine. But as soon as it's systemic, as soon as it's affecting the rest of your body, then be really cautious.
Yeah, absolutely.
Actually, that kind of brings up another question about sickness. Is there a worry for you about sickness and how that affects the gut?
There is. So if you look at the statistics especially from large international sports competitions, like the IOC statistics that come out every 4 years, secondary to musculoskeletal gut issues are the most common thing that affect athletes. And it's usually diarrheal illness. And as gastroenterologists, we rarely get involved in the management of acute diarrheal illness, because most of them are self-limiting. So, anyone can get a norovirus or, a bad case of infective diarrhea, and usually it's settled within 24 or 48 hours. But that's a critical time for all professionals that work in sport to know, you actually have to work really hard to keep them hydrated. And often oral rehydration solution is fine. Sports drinks can sometimes be too concentrated for that situation. So you may want to dilute down the sports drinks, just use something like Pedialyte. And make sure that they are symptom free. You also don't want that illness running through a whole team. So keep them isolated, keep them hydrated. And then just get them stepwise back into training and performance. There are some really nasty gut conditions that can cause a picture a lot like inflammatory bowel disease. So these are the dysenteries, the sort of bacterial infections of the gut, like E. coli and Salmonella. You tend to know that they need an escalation of care because those athletes are going to be febrile, they're going to look really unwell, they're going to be in a lot of discomfort. And so they're the ones that probably need to go to the ER.
Well, sweet. One of the questions I had too was about traveling with athletes, and so common when people travel, you'll hear they talk about like, oh, I haven't pooped in a couple days. Is that something that's of concern to you, or is that something that is just it's going to pass?
Yeah. So I in a past life I was a team physician for some very large like international sports tours, and it was always a factor. Like the gut gets messed up. The environment changes, the bugs that you're exposed to change, the diet changes, your sleep changes. And it is a factor. Like we all think about it quite a lot, and sports science has done quite a lot of work in this area. And, that's one of them is the exposure to bugs on planes. And that's where the probiotic studies and chest infections came from. There's the pragmatic kind of clinical gastroenterologist in me says, don't worry about it. Get over it. It's a couple of days, right? It happens to everyone. Just drink well, take plenty of fiber, try and stick to your routine as much as possible. It's going to pass. And 90% of the times it does. I think that there is a reasonable kind of space to explore what works and what doesn't. So I think that, sports science does have something to contribute there. But sometimes you can get a little too obsessed with one extra bowel motion or, one fewer bowel motion a day. And I spend half my time in clinic just trying to tell patients that it doesn't matter. What's normal is hugely variable. And it's going to vary in you as much as it's going to vary between you and the rest of the population. So a little change here and there, don't worry about it. A big change, particularly with some of those red flags we talked about, sure, I'll investigate that. We'll get deep into that and we'll figure it out. But everyone's got to expect a little bit of variation from day to day.
For sure. You ready?
Do you have any other questions before we hit the action item?
I think it's time for some action.
All right, let's do it. Here on AT Corner, we like to finish up with like an action item that athletic trainers can take away today for their practice. So today we'd just like to ask you, how could an athletic trainer educate patients on the importance of GI health and athletic performance?
So I think we've talked about a lot of this, and really those red flags that were mentioned a couple of times over, the bleeding, fevers, blood mixed in with the stool, or signs or symptoms of dehydration. You should be well aware of those and educating your athletes about those. But beyond that, I'd say it's really that point that any athlete with a persistent symptom that is not going away and is affecting their training or performance should see a gastroenterologist if it's a GI symptom.
For sure.
Well, now we're going to have to add Team GI to our list of physicians.
The sports medicine team.
Yes, and I hope that other athletic trainers will as well, because this is such an important aspect.
Yeah, and I'm happy to have conversations, if people are not, especially early, if it's not part of your practice to refer patients with GI issues, then sometimes the first question is, should I refer this patient? And that's probably the time to refer them, or at least start a conversation. I'm happy to be contacted. I can provide you guys my direct contact. And I think there needs to be conversation about these things, and then we can work out what, that's fine. That doesn't need to be seen. You guys can deal with that. And I want to see this guy quickly.
For sure. That's awesome.
Awesome. Thank you so much, Dr.
Thank you so
Fearn.
much.
No, thank you guys. This has been really fun.
So glad to have that interview with Dr. Fearn to kind of touch upon so many different aspects of GI health, but also something that I was thinking about afterwards, after a conversation, is it really also goes back to the rapport you have with your athletes, because only some of this are you going to be able to see it manifest, but a lot of it you're also going to have to really dig in with your history. You're going to have to be able to create a safe space that they can come tell you these things, and also make it approachable so they actually do come and feel like you can have an answer for them of who they can go see.
Yeah, for sure. I mean, yeah, you got to really create a safe environment because you're going to talk about poop, and and that can be uncomfortable for some people to just talk about their digestive system like that.
As we like to say, poop positive.
Yes. What I really took away and what I enjoyed about this interview was just how easy Dr. Fearn made it to just really kind of identify what should be referred and what are some kind of red flag things to look out for. Because like in the GI system, there's a lot that could be going on. And there's a lot of symptoms that mimic a lot of different things. So I think that was really digestible and very helpful.
Pun intended.
Yes. I actually didn't mean to do that. So that's perfect. It was just organic.
Yes. When in doubt, send to a GI so they can do all the testing and expertise that they need.
100%. And maybe stay away from the Hot Ones challenge before competition. I think that's a good moral of the story from this episode.
Yeah, so if you guys are new, we do several different types of episodes. More recently, we've been doing a lot of interviews, including a lot of UCI health physicians. So thank you so much to UCI Health for their expertise. We also do education and experience episodes where education, Randy takes they're actually good for CUs, for athletic trainers. So Randy reads a bunch of articles. He synthesized them. We talk about them in a conversational format, and you can get CUs for them thanks to our partner, Clinically Pressed and Athletic Training Chat. We also do experience episodes where we bring story topics from all over, and we ask athletic trainers about their experience in those, and they share stories. And then we also do BOC IRL episodes if you're studying for the BOC, where we talk about stories of BOC topics in real life, and interviews just like this one. If you guys are interested in any of those, make sure you check the show notes or listen to us on any of your favorite podcast directory. And I think that's all I got.
Thank you for helping us showcase athletic training behind the tape. Bye.